reason people don't like the respiratory system? And it's certainly not the teacher. All right, here we go. Okay. All right, so just so you know, we got a couple of stars here. We got Glenn Close. All right. And then, of course, we have Tiger Woods with pneumonia. Don't that look like Tiger Woods? Right? And then Glenn Close. And then for the kidney, we have, got Kenny from South Park. Okay, here we go. Question number 1. These are the functions of the respiratory system. I'm not writing them down. You write them down. I'm going to add, though, a little bit. How does it help maintain the pH of the blood? By controlling CO2 levels, right? Because CO2 is an acid. And how do we know it's an acid? For a minus 10? CO2 plus Wawa.
Combines to form carbonic acid.
And then carbonic acid dissociates into what? That's right. You just guys will not love this equation. If you love it, like a child with elephantiasis, right, I will force you to love it. Say yeah. The warm filter and humidifying the air, that's done as a result of the upper respiratory system. I'll explain that in a minute. Do you know anyone who's on a ventilator long-term ventilator? No, I'm talking about where they're trached, right? A long time. So are they on a ventilator or just the trach? Okay, so the upper airway is everything above the larynx, the voice box, and up. So if you lose the upper airway because you are trached and on a ventilator, then you have to warm the air, so that ventilator has to have a heater on it. It has to have a humidifier on it because you lose the ability to humidify the air. And you got to have that filter as well. So that's why you have to empty the little doohickeys if you have someone who's on a long-term ventilator. So they'll have a little thing that will heat it up to 98.6, humidify it, and filter it. Say yeah. Okay, here we go. Terms you got to learn in advance now that you just wrote down in general. What's ventilation? Come on, help a brother out. Breathing? No. That was the only one you got, and right, and then yeah, boom, here it's over. Come on, Lily, get it right. Give you a here. You can have an invitation to the Gateway Employee Clinic. No? I better tell you, right? It's the movement of air in and out of the lung. You can use air in this case. Air in and out of lung. You got me? Of your lungs. That's so ventilators ventilate, right? Then you have respiration. What's respiration? Come on. Come on, make Timmy happy. Huh? No, that was ventilation. Nothing? No, that's ventilation. There you go. Respiration is the physical exchange of gas, and there are two types. You have external respiration, right? And external respiration occurs at the alveoli and the pulmonary capillary. And I'm spitballing here, hoping for something. Where is internal respiration? There you go. So internal respiration is at the systemic capillary in the cell. Boom. And normally there's a 1-to-1 ratio, meaning the amount of oxygen the cells of the body are using and the amount of CO2 that they produce is the amount of CO2 that the respiratory system gets rid of and the amount of oxygen it takes up. Say, yeah, you got that. Okay, I'm working on a theme here. What's the goal of the body? What's the goal of the cardiovascular system? So what's the goal of the respiratory system? Maintain breathing. No, you're missing letters. Yeah, nobody knows how to play this game. It's to maintain airflow. So anything that flows has to follow our buddy, our pal, Ohm's flow law. Are you ready? You guys look like you just want to pass out. And before you do it, you want to take a pipe and go right upside my head with it. Is that about right? Alicia, how do you feel about that? Is that pretty accurate? There was hesitation there, clearly. All right, so Q, better write this down, is airflow, right? And that's equal to the change, in airway pressure, divided by, you're not going to believe this, the resistance to airflow. Whee! What's the only part of the respiratory system that's made of muscle? You know what? That's right. That's right. That was a poor question. What's the only part of the respiratory tract that's made of muscle? I'm waiting. Who said that? Tia! Tia! That's all I'm giving. I got up early too, 4 o'clock this morning, right? I'm ketotic. Yep. Right. That'll be your thing on the board when you take the cardiovascular quiz. But it could mean something else, like turd. Don't you think that's a fun word? Turd. It sounds just like it looks. Turd.
She answered it correctly. You're the turd.
No, T is not a turd. No, but T could mean turd. We don't know that. Whatever. You know what? Let me tell you something. When this class is over with, you're going to miss me like you miss a boil. I don't even miss me. Are you ready? Somebody said it right. Yeah, okay, good. Bronchioles. Eels. The bronchioles are made of muscle. So by changing the diameter of the bronchioles, that can affect resistance to airflow. Tell me you got that. This is very important that you understand this. Okay, what I'm going to do very, very quickly, is I'm going to review some of the anatomy of the respiratory tract that you clearly learned in general. And I know this, right? Right, Maddie? See, Maddie's all about it. Here we go. All right, write this down. How does blood flow in an artery? Took 2 weeks. What? Say that? Took 2 weeks in the advanced class in Kenosha to get that one right. They're making up words. It flows in a laminar fashion. What that means is this, is that the plasma of the blood flows on the outside and the formed elements of the blood flow in the middle. Say yes. Do you want air to flow in a laminar fashion? Yes or no? Autumn, do you want air to flow in a laminar fashion? Okay. Say no. Good. Watch. That's why we have two nostrils and not just one big one. Right? Watch. Watch. And I'm going to explain this. Look. Remember cow and chicken? That looks like cow's nose, don't it? Right? What separates your nostrils? The nasal septum, right? So when you breathe air in, it goes into one nostril, then the other, and it collects in the nasal cavity. Wait. Yeah. Right over here. You got me? And the nasal cavity will create turbulent airflow to mix the bad stuff that's in the air so that the ciliated and mucosal lining that's produced by goblet cells will catch the bad stuff. So you want turbulent airflow in the upper airways. Say yes. Once the air is clean, right, and it's cleaned in the upper airway, you want that air to flow in a laminar fashion, which it does. Say yes. Guys? Now, let's think about this. If you had one big nostril, you could get your thumb in there. Dig. Can I tell you something? This is a fact. I was working in my kid's basement on Sunday, right? And you ever build a plane, like a paper plane, and you throw it, and it goes like that, just straight down? Right. So I blew a snot rocket, and it was like a paper plane. It just went boom, right down on the floor. Well, I'm going to clean it up later after it dries. It's a mess. The floor's a mess. Why are you looking at me like that? If you work on a construction site, dude, you're blowing snot rockets left and right, right?
Well, I use napkins and paper towel, but I don't just fling it on the floor because I'm tiling the floor.
Oh, that makes sense. Yeah, let me tell you. Let me tell you. The plumbers and the carpenters, they're blowing it right on the floor. Okay? I just wasted 42 seconds of your life that you'll never get back. Tell me you followed that, guys. Okay. So let me go through this really, really quick. First of all, what kind of lining does the respiratory system have? Yeah, I said that. What else does it got? What?
Cilia.
What are you guys? You pulling teeth here? Right. Better write this down. Please write this down. The lining, the internal lining of the respiratory tract, number one, very vascular. Vascular, yep. Lots of blood vessels. Number two, it's ciliated. What does cilia do? It moves stuff. Number three, it has mucus-producing goblet cells. And the function of the mucus is to catch the bad stuff and the cilia to move it. Say yeah. Okay, here we go. Hang on. I drank a bunch of that Diet Mountain Dew. I gotta go pee real quick, okay?
How do you know for sure? It's 7 days after the date closes. So you don't count weekends, and that's the same thing. It'll show on what advisors, and then you'll get the email. You might get the email like a week after that, but it shows on the My friend said it only took her 4 days to see if she had it or not.
After the business day?
Yeah. No, after it closed.
Right. So,
Yeah.
business.
She said her skin.
Liv said she got an email first before it showed up.
My counselor said you'll see it on the supervisor first. Maybe change.
No, maybe it was different before.
Oh, he's gonna take nursing in the summer as an addition now.
It's the same.
There's wouldn't it be all fall?
No, there's 16 slots for people to go petitioning.
Oh, really? That's nice then.
Yeah, the first semester.
Would you do summers?
I have to take micro.
Yeah, we do.
So that's why I took
If I
micro,
can.
because I can.
Yeah.
If not, like, I'll probably just work a ton. I don't think you can go part-time this summer. You can't, I don't know, I don't think you can do just supplementals and stuff like that.
You can, because my friend failed it and then she took it in the summer.
So
she
when
was
did you-
behind.
And
Also,
maybe
when did you take your test again?
I already,
Did you have it?
when did you
Were you
pay?
having trouble with those? Trouble?
Science.
Were you able
Science is
to
the hard
petition?
Yeah.
You did.
Did anybody else petition?
Autumn did.
Who did?
So I think it's like 7 to 10 days.
Okay, sorry about that. Okay, here we go. I'm going to answer a question. Nobody cares. You don't care, do you? Do you? Okay. Feel like I'm totally being ignored tonight.
Only because we're focusing on stroke projection fractures.
All right, if you say so. Well, I got to do my thing though, so I'm not even gonna look. Yeah, I'll put these glasses on like Big Daddy. Yeah, I can't see you now. You could be drooling, I wouldn't know it. Okay, here we go. Oh wait. My kid's 21 now. Yeah, you know what that means? No. Hang on. No, he can actually, now he can go buy me beer. See? I thought about that today. I'm like, sweet. I couldn't do that though. That'd be like using your kid. Why not? You can tell I live in the past, right? Okay, here we go. You'll know what question I'm about to answer. Ready? What? Wait, hang on. I'm not going to tell you. What happened there? Oh, skip. Oh, wait. Okay, here we go. Ready? Want this whole thing. Whole thing. About every 5th or 6th cell within the respiratory tract, you have a specialized cell called a goblet cell. Gobble, gobble. Do you guys remember the law of electroneutrality? Probably intimately. Probably discussed it this weekend, as a matter of fact. Right? So watch. What the goblet cell does, and we'll make this green because the person may have a lung infection. Right? That's the mucus that's produced by the goblet cell, and it rides on the cilia like a little blanket, and the cilia move the mucus blanket after it caught bad stuff. You're with me? You're following this a little bit? All right. Now, embedded in the cell membrane of goblet cells are these little ion channels. And these little ion channels move ions. Are you writing that down? Okay, so In goblet cells embedded in the cell membrane, there are chloride ion channels. And this is a chloride ion, and this is a chloride ion. You got me? And you also have sodium ions. Now watch. When the mucus is produced by the goblet cells, chloride will leave through a chloride ion channel and enter the mucus. That's a negatively charged particle. So to maintain that law of electron neutrality, a positively charged particle, sodium, will follow it. And what follows sodium by osmosis? Water. So you are adding water to the mucus. And anytime you add water to anything, you thin it out. So there are people out there who have a condition called cystic fibrosis, CF, where there is a genetic anomaly where they do not have chloride ion channels in mucus-producing goblet cells. So when the goblet cell makes the mucus, there's no chloride channel, or it's, deformed, mutated. So if chloride doesn't leave because there's no chloride channel, what doesn't follow it? So if sodium doesn't follow it, what's not going to follow the sodium? So what happens to the mucus that they produce? It's really very thick. Now this is important to note, and just understanding this basic concept is critical if you're ever going to understand how cystic fibrosis works. What it does is it affects any part of the body that secretes mucus. So that includes your respiratory tract, your GI tract, right? Turd, right? And your reproductive tract. So these people have a lot of GI problems. They have pancreatitis. They develop pancreatitis. They develop constipation with what's called a telescoping bowel, where part of their bowel will start coming out of their butt. Literally. I'm not lying, right? And how it was diagnosed is on a chest or on an X-ray, they saw cysts, scar tissue in the pancreas. That's how it was first identified and called cystic fibrosis. The most common cause of death in people with cystic fibrosis is respiratory failure, and they live to the ripe old age of about 40. And because they can't move the mucus builds up in the lungs, so they have respiratory problems. They also have respiratory infections, which leads to inflammation and scarring of the lung and loss of lung tissue. So this is just not a good deal.
Is that why some of them are on trachs?
Yes. Tell me you followed that. You got that. So most people think of cystic fibrosis as simply a respiratory disease, and in fact, it is not. All right, if you take my pathophysiology class, and after this class, I might not even tell you that. Like, why would you endure the pain? But I'll explain how they treat that and what you do for it. So that's the lining of the respiratory tract. Tell me you got that. All right? All right. All right, so let's take a little quick view here. This is my uncle of the upper respiratory tract. Now, look, and you probably can't see it from there, but if you come, like after class, you can see a little fixident right here. And I remember his last words were, fixident and forget it. And then he just died. Then they cut him in half. Thought it was a little quick. Anyways, I digress. You know what I'm getting? I'm getting me a GoPro. I'm not even playing. All right, watch. Air that you breathe in through your nose is cleaner than the air you breathe in through your mouth. And the reason is that the nasal cavity has these nasal concha, which increase the turbulence of the airflow, and it's got a huge mucosal membrane. So it catches any of the bad stuff, and then you get big googies. You ever see that like 5-year-old kid? and it's like this weather, where he's got that booger that completely blocks the nostril. And then as he breathes, it moves in and out, like that tympanic membrane booger, right? And you know it's been there a while, too, because the outer part is like dried and crusty. It's not like it just happened. I'm just saying. He's a future snot rocket blower.
Piston of an engine.
I know. He's running a thing. Could blow a balloon up. Okay. Say yeah. Guys? Okay. Now, what's the bone that forms the hard palate of the roof? The what?
The palatine bone.
That's right, the palatine bone. Now watch. Watch, guys. When you were forming in your mommy's womb, right, the two sides of your face actually come together. That's why you got this little doohickey in your lip. That's where the two sides of your face came together. So the two sides of the palatine bone come together to form the roof of your mouth. Some people, you can actually, they have like a ridge there, right, where you can see it. Some people don't. Some kids, the roof doesn't completely form, and the lip doesn't completely form, and the gums don't completely form, so they have a cleft palate. And the problem with that is that now there's an abnormal connection between the oral cavity and the nasal cavity. So they have all kinds of breathing problems, and like when they're eating, they're aspirating food into their lungs. So, and that surgery now is pretty straightforward, right? And you've probably seen someone with a cleft palate, and the surgery now, they're so good at these young kids, you wouldn't even know. It's like they've done it so well. So then you have the soft palate. The soft palate is actually cartilage, and it will move. The function of the soft palate and the uvula, the little dingleberry that hangs in the back of your throat, little punching bag, that's a direct food into the esophagus. Now, is there bad stuff in the air? Yeah, pull my finger, right? Find out. So you have, I know, that's a guy thing. You have adenoids. Adenoids are lymphatic tissue that protect the nasal airway. Then you have the tonsils, right? The lingual tonsils, right? And the palatine tonsils that protect your oral airway. And because we have a redundancy with cervical lymph nodes, submandibular lymph nodes, supraorical lymph nodes, you can have the adenoids and tonsils removed without a huge blow to your immune system. So if you have a kid who snores, 5, 6, 7, 8, 9, 10-year-old who snores, you need to have them go to an ENT. Little kids shouldn't be snoring. And usually they have enlarged tonsils or adenoids. Anybody, you guys snore? You snore? Do you snore?
Only when I'm really tired.
Oh.
Why is it that we snore when we're really
You
tired?
mouth breathe, right?
Well, that and depending on the way you fall asleep. Like for example, in class it makes perfect sense, right? Because you cut your airway off. Like I only snore if I lay on my back, right? If I fall asleep on my back, right? So a couple of times, like you'll sleep, I'll fall asleep in my recliner, and then I'm like, right? I'm like, damn. And you know about obstructive sleep apnea, right? Know this, when you go into REM sleep, the restorative sleep, there's a part of your brain called the reticular activating system that partially paralyzes your skeletal muscle. Because what you don't want to happen is your brain thinks you're active during your dreams. Like a monster's coming at you, like the AMP monster, saying, read, right? And you're running. You notice how I got a lot of the textbook things in there for the answers too? Nobody picked those, by the way. Anyways, in your mind, you feel like you're running in jello because there's a disconnect between what your brain is thinking you're doing and what your body actually does. So when you go into REM sleep, the neck muscles become partially paralyzed and some people get their airway cut off. So what do? You have to increase the airway pressure so you're snoring. And what happens, and you don't even know it, is that you wake up hundreds of times during the night, and when you wake up in the morning, you feel like you're in a fight because you didn't get any restorative sleep. So the CPAP max works by giving you, watch it, you're not going to believe it, continuous positive airway pressure. That prevents the airway from collapsing when you go into REM sleep and you get that restorative sleep. Say, yeah. Too bad it ain't on the test. Right? Just tell me what's on the test, Timmy. I just wasted your time. And as you gain weight, it makes it worse. So what do people do when they don't get sleep? They catch up on sleep at school or at work, right? They fall asleep in class or they fall asleep at work. And then they need to stay awake, so they go get that sugar buzz. And then they start gaining weight, and that makes it worse. So the question I always ask is, if you're driving in a car, right? You're not driving. You're a passenger in a car. Can you fall asleep? And if you're at a long light or something like that, or like a train, have you ever fallen asleep? And people are like, yeah. And I go, do you feel well rested when you get up? No. And you probably have obstructive sleep apnea. So go get it taken care of. Reading the textbook reduces that risk, by the way. Tell me you're following this. Okay, now watch. What's this doohickey right here? Just read the word, actually. There you go. That covers the trachea, so to prevent aspiration. And the hyoid bone is connected to the base of the tongue, and as you're swallowing, the hyoid bone pulls back the tongue, and that closes the esophagus and prevents you from aspirating. Tell me you're with me. Okay, watch. Okay, who did not have me for general? Okay, Tia, where's your tear gland? Right there in the corner, right? So let's look at this for a minute. If your eye was a window, would you start washing it in the lower corner? Would you? No. Where would you start washing it? So your lacrimal gland or your tear gland is right here. Here in the corner, right here, you have these little ducts, these little sacs that drain tears and then into the nasal lacrimal duct. That's why when little kids don't get their G.I. Joe with the Kung Fu grip, like I didn't, I'm like, and that's why their nose runs when they cry. Isn't that sad? So when you cry boo-hoo, you get those really watery boogers. Then the dude with the tympanic membrane booger, when he cries, that thing gets huge. Just hangs there. See, yeah. Okay, this is what I wanted to show you. Watch. Oh, first of all, when you're watching movies and they cry out of one eye, it's fake. The only way you can only cry out of one eye is if you've had a stroke. So these people in these movies are stroking out. Tell me you're with me. Has anybody ever just cried out of one eye? You know what I understand is why we cry. Like, what's the physiologic purpose of crying? I don't know what it is for.
It makes you sleep. Yeah, it makes you really tired. Why does it make you tired?
I think like really strong emotional events stimulate the parasympathetic nervous system. Rest and digest. Probably because you're sad.
He always has like the best responses to anything you ask him.
No, it irritates the cornea. And when you irritate the cornea, it causes tearing. That's why your nose runs in the winter. Dry air can dry out the cornea. In the wintertime, it's dry. So the lacrimal gland will produce tears to keep your cornea moist. That's why your nose runs in the wintertime and it doesn't run in the summertime. unless you got a cold and a tympanic membrane booger. I'm like a dog on a bone with the tympanic membrane booger. Okay, this is what I wanted to show you. Watch. These are your sinuses. Your sinuses are hollow chambers in your skull. Write this down. They have the same mucosal lining as the respiratory tract. So it is ciliated and there are goblet cells. Say yeah. Guys? So watch. Is the lining of the sinuses vascular? Yes, it is. Watch it. How many people got hay fever? Sinus problems. Yeah, big wow. What do you want from me? I do too. So in this case, what we're going to do is we're going to make the lining, we're going to make it blue so that it will show up. Tell me you got that. Now watch. You're going to produce mucus, and that mucus is going to drain into and through these little holes called ostia, and then drain into the back of your throat. Tell me you got that. Guys? Now watch. If you have hay fever, you're going to have an exaggerated immune response, and you're going to cause the release of histamines. Who's with me, guys? Histamines produce massive arterial vasodilation. Where? No, not everywhere. If you got hay fever, in your sinuses, your eyes, your nasal cavity. You got me? So what's going to happen? Those blood vessels are going to dilate, right? And you will get increased mucus production. So what will you do? You will block off those ostia. And when you block off those ostia, any mucus that's produced cannot drain. That's why you get the sinus pressure and pain. Say yes. Guys? Okay, watch. So if you have that, what do you take? You take an antihistamine. Writing that down. But sometimes, now you better write this down because when they get to the immune system, I'm going to explain this. Histamines, antihistamines don't do anything for the histamines that are already released. They just prevent the further release of histamines. So what did the histamines that were released do? Massive arterial vasodilation. Say yes. What do you want to do to that mucosal lining? What's blocking the mucosal? No, they're already dilated. Oh boy. That took a while. So watch. You will give them, watch it. You will give them an antihistamine with a decongestant. The decongestant is pseudoephedrine. Sudafed. Pseudoephedrine is fake epinephrine. What does epinephrine do to arteries? That's why I watch. If you have high blood pressure, talk to your doctor before taking Sudafed. If you have thyroid problems, talk to your doctor before taking Sudafed. Why? Get this right, Tamaya. You get my phone, these cards, and I'll give you a key to the lockbox where I put my labs. You're just going to stare at me. Come on. You will give everybody an additional 50 points on the cardiovascular quiz if you get this right. Oh, now you're paying attention, huh? Why, if someone has thyroid problems, do they have to be careful about taking Sudafed? We already established that. Why thyroid issues? Yeah, who cares? Maybe you want that. It's the one function of thyroid hormone that a lot of people forgot. That's so close. That's right. It increases the sensitivity of epinephrine and norepinephrine, so it can throw you into tachyarrhythmias if, tell me you got that. So now, if you're taking something that's fake epinephrine and now you're adding more epinephrine to it, it's going to make those effects more sensitive. Did you see that? All right. You guys were definitely not thrilled with that. Definitely not thrilled. Say yes. Okay, here we go. Ready? Let me go over this. I'm going to go over this very, very quickly. I'm going to go over the outer layers of the respiratory system. You've had this before. Write this down. What are the outer layers of the lungs called collectively? They're called the pleural linings. Please get this. Very important. Very important that you get this. Watch. You have a visceral pleura. And this is very important. The visceral pleura of the right and left lung are separate. The visceral pleura is the thin saran wrap that covers the lungs directly. Each one, the right and left lung, the visceral pleural lining is separate. Then you have a thick, tougher lining that lines the inside of the rib cage called the parietal pleura. Say yeah. And each lining, each visceral and parietal pleura of both the right and left lung are separate. This is very important. That means that if one of the lungs collapses because they are in separate sacs, it won't cause the other lung to collapse. So anatomically, that's a good thing. Say yes. Write this down. The parietal pleura of both the right and left lung is directly connected to the diaphragm. The parietal pleura of both the right and left lung are directly connected to the diaphragm. Who's with me? And the pleural linings, both parietal and visceral, are serous membranes, meaning they secrete a viscous fluid that prevents the linings from rubbing on each other during inspiration and expiration. Say yeah. Watch. How many people want to work in an emergency room as a nurse? Anybody? You do? Okay. Well, listen up because I'm going to teach you something. If you're a triage nurse, what do?
You check the person in and take their initial
Determine which is like
their acuity.
what goes first.
Yeah, you do triage. That's how you call it, triage.
Yeah.
Triage is determining the severity of a patient, which one goes first, second, third. Tell me you got that. So if somebody comes in complaining of chest pain, you can ask them a couple simple questions to kind of rule it out. All right? If they come complaining of chest pain, one of the things that physicians and nurses will do is say, take a big deep breath. And when they take a big deep breath, does it hurt more, less, or the same? If it hurts more, then it is probably chest wall pain, and that's not as serious as cardiac pain. The other thing, if you've ever gone in for chest pain in an emergency room or help someone, they'll take their hand and they'll push on their sternum. Does that make it worse? if that does, then it's probably chest wall pain and not cardiac related. Say yes. There's a condition called pleurisy. People who do a lot of amphetamines, crack cocaine, because they're breathing faster, that can actually dry out the pleural linings. They can get a condition called pleurisy or pericarditis. You don't want that. You want to go to Gateway. Tell me you followed this. Okay, write this down too. Can you blow out all the air in your lungs? Tim can't come to class today. Blew out all the air in my lungs. Don't look good. Can you? No. That's because, watch it, there is a negative pressure within that pleural space. That pleural space acts like a vacuum to prevent you from completely collapsing your lungs. Tell me you got that. It's about a negative 5 centimeters of water, negative pressure. Got me? I don't care about the numbers. Just understand that it's relatively low. All right. Now watch. How many holes do you breathe out of? Two nostrils and a mouth. All right? Write this down. Boil. Did I spell boil right? I know, because I was making it an L, and then I was trying to be cool, like I wasn't misspelling it. There, how about that? Is that better? Do you guys remember chemistry and the gas laws? Well, the gas laws will be coming at you. I know. Yeah, get on. All right. Boyle's law states that volume and pressure are inversely related. What does that mean? When the volume goes up, the pressure goes down. Say yes. All right. Watch. What's directly connected to the parietal pleura? The diaphragm. The diaphragm is a dome-shaped muscle that separates completely the thoracic cavity from the abdominal cavity. Are you ready? When the diaphragm contracts, it flattens out. Who's with me? And when you flatten out the diaphragm, what's connected to the diaphragm? The parietal pleura. So it will cause the lungs to elongate. So what happens to the volume of the lungs? It goes up. So if the volume of the lungs goes up, that's going to have a corresponding decrease in the pressure inside the lungs. And what will happen is atmospheric pressure will become greater than the pressure in the lungs, and air will move from high to low. Say yes. So we breathe based on changes in pressure. Okay? Watch it. Come on. Give me to like 8:20, then you can ambulate. Do you want to take a break for like 5 minutes and go pee? Do you? Go ahead. Go take a break. No, we've been at it. Plus, you were, maintaining your concentration for Kahoot. Some of you, it was amazing. 67 questions. You guys were just like machines, knocking it out. Angelica, look, right. You were like a woman possessed. You were killing it. I'm proud of you. Who got second? Autumn? Yeah. Celeste, did you win? No. Are you okay? Are you? Tamaya, are you tired? What time did you get up today?
9 o'clock.
Was it a holiday, Uncle Billy?
No, I don't have that till 11.
You didn't have to work today? Did you have to work today?
Every day,
You work every day?
Monday through Friday. Is that one over here?
How many people work full time here?
I don't really work full time though. I work like 6 to 11, 6 to 12 sometimes.
6 in the morning?
I'm technically considered full time, but I don't get all my hours, so I'm not full time. Yeah, 6:30 to 11.
Do you work full time? Do you work full time, Tama? Celeste, you work full time? Sheila, you work full time? Kayla, you work full time?
Yes.
Angelica? Autumn? You know what I like to do is get mug shots of all of you and then have put a line up there and show my kid, these are all the students that have to work full time while you sit on your fatty ass and play games. You know what he did? He bought a GameCube. You know what a GameCube is? I kind of like that game. You know what I like? Monkey Ball. I actually got pretty good at that. You ever play Monkey Ball? I liked it. Did you like Monkey Ball? I was actually good at that. You like Monkey Ball? How old are you?
21.
How old are you, Celeste? You didn't never heard of Monkey Ball? You hear of Monkey Ball?
The game?
Yeah.
I love that
So
game.
do I. My
Wait,
kid.
what was that game on?
GameCube.
GameCube. I love that game.
My kid bought a GameCube.
My brother just bought the Nintendo, the one, the little
Yeah, I got
take
the.
off the
Yeah,
controllers. He bought that one. He loves it.
I got the Atari.
What's that?
You guys are too young to remember this, but Pong, where all it was a.
2 paddles. and
Yeah.
bounces.
They had hockey and tennis. That was it. I had to walk to school uphill both ways. 10 miles. My mom would make me a baked potato, and I
Do you
put
like
that in my
Crash?
pocket to keep my hands warm, and then I ate that for lunch.
Did you play Crash?
Crash?
Yeah. Bandicoot. That's a good game.
No?
Yeah, that's fun.
I like that. I like Monkey Ball, man.
Yeah,
Telling
that was
ya.
a fun game. Collecting the bananas.
Yeah. And then trying to land on that, like,
And the thing,
yeah.
excellent.
Then you run out of gas.
Yeah, that game's good.
I really practiced that.
Mario's the best, but Mario, not me.
Yeah, my girlfriend's son, he's like, don't you have Mario? With the dude with the hammer, right? And he would just beat on people?
Oh, yo.
Ain't that Mario?
No.
Or is that Donkey Kong?
That's, who beats the hand? That's John, no?
That is tough.
Is it?
If you get the hammer, you don't just run around with the hammer.
Right?
Oh.
No, I like Call of Duty. Ew. I've never played that game in my
the
life.
mission part.
My nephew
It's probably like that.
took an ashtray and threw it through his flat screen TV, of course, that he didn't buy. Right, because he's an idiot.
Good thing you only have one nephew.
No, I don't.
Oh, you don't?
No, but I just have one
he the
major,
worst? Oh,
yes.
yeah.
He's an absolute human. He's just a turd.
Do you hang out with him?
No.
Come on, that's delete this video.
I emailed you already, Tim.
Huh?
I emailed you already.
About what?
The video.
12?
This one.
Oh.
Yeah, but I did good. I've been uploading the videos,
Yeah, I did. Well, you did it, and then I emailed you, and then you did.
Does she have any idea what she has in her class? Any? There ain't no mouth on her. Okay, watch.
Trouble that close the palate, that's right.
Yeah, yeah.
Carrie
If
took
your
him
jawbone's
out.
weak, then they just put a spring there.
Let's go get Carrie.
Okay, watch. Look at the ribs when they come off the spinal column, right? Not the spinal column, but the vertebral column. They go down. What are these muscles called that are in between the ribs? They're called intercostal muscles, right? So when you need to get more air into your lungs, you start using the accessory muscles of breathing. which are the intercostal muscles. So when they contract, it will pull the ribs up. And when you pull the ribs up, that increases the diameter of the chest. Tell me you see this, right? So if you have a little kid with asthma, right, and their bronchioles are constricting, the diaphragm is going to contract massively. Have you ever seen a little kid that's breathing real hard and their guts look like they're sticking out? Yeah. Right? That means they're really contracting their diaphragm massively. Also, they will start contracting the intercostal muscles in between the ribs. And you can actually see the spaces between the ribs. It's called intercostal muscle retraction. If your kid is doing that, you pick him up like a little football and you get his fatty acid to the emergency room, he's in trouble, or she's in trouble. Say yeah. So when you increase the volume of the lungs, right, you're going to decrease the pressure inside the lungs. Tell me you got that, guys. So this gets a little, I'm going to try and explain this. So watch. If we look at Ohm's flow law, and we talk about the respiratory system, right, where Q is airflow, what you're really talking about is the difference in pressure between the atmosphere and intrapleural pressure, or pressure inside the lungs. You got me? So if you make the pressure lower, watch, I'm going to make up some numbers. The standard pressure in the atmosphere, is 760 millimeters of mercury. You got me? Normal breathing, you got to make it like 755. Tell me you got that. So what's the difference? 5. So if you want to create a greater difference in airway pressure, you create a greater volume, and when you create a greater volume, that will drop the pressure inside the lungs. So when you create a greater volume, now you're going to have a greater difference in pressure. Say yes. You're following that. So you don't suck air into your lungs. What you do is you create a greater lung volume and air moves in by pressure differences. Yes or no? Guys? A little bit? Okay. So remember that pressure difference. Okay, watch. One more thing. When you take a breath in, what happens to the distance between your ribs? So do that, especially in front of your boss, or people who can have a profound impact on your life, right? Just walk around going, that'll look good. So get this. When you breathe in, the distance between the ribs increases. When you blow the breath out, what happens to the distance between the ribs? It decreases. How many people got that? All right, so watch. Now, I find this hard to believe, but this could potentially happen. If somebody didn't like you and they took a knife and they stabbed it into you, ouch, that's a knife, right? Now watch. If you pull the knife out, you have now created a hole. Are you with me? What happens to the distance between the ribs when you take a breath in? It gets bigger. So the hole gets bigger and it will suck air into the pleural space. Who's following? When you blow the breath out, what happens to the distance between the ribs? It decreases. So air gets trapped. It's like a roach motel. Air gets in, but it can't get out. So with every breath that you take, I'm watching you. With every breath that you take in, you will begin to compress the lung. And because you can't get the air out, you develop what's called a tension pneumothorax. You've heard of this? It's a sucking chest wound. And any chest wound, in my opinion, sucks. But in this case, it actually does. Tell me you got that. So if you come upon someone and they have a knife in their chest, do you pull it out? Why not? Well, why can't you pull out the knife and then just pop your fingy in there? You could. Watch. Yeah, you would. When you cut bread, do you cut it like this? You cut it like this. The knife cuts both ways. So when it goes in, it's going to cut, and when you pull it back out, it's going to cut. So that guy might be still alive, then by you pulling that knife out, you cut a major artery, and boom, the guy dies. So you leave the knife in there, you pack it around so that no air leaks around it, and get their fatty acid to the emergency room. Now, if somebody stabs you, right, and you got a bunch of holes, then you're plugging them. And if it's somebody you love and you ain't got, right, you stick a hole, you cover that hole up. Tell me you got that. So, I don't have time, but I can show you how to actually make a homemade one-way air valve to prevent a tension pneumothorax from getting worse. I patented it. It's called the Timmy valve. Right? If you buy now, if you call 1-800-SIR-MIX-A-LOT, you'll get a Timmy valve and a Ginsu knife. Do you want a Ginsu knife? Do you know what a Ginsu knife is? It slices and dices and makes julienne fries. Nobody cares. You guys are barely alive. You're barely breathing. You guys probably got tension pneumothorax, don't ya? Wait. This is an actual needle decompression. It's a one-way valve for a person who has a tension pneumothorax. It's in Russian, so I'll interpret. If anyone can tell me that guy's name, too, I'll interpret that. Couldn't be Bill Smith, huh? Maybe that's Bill Smith in Russian. So you stick the needle in. Now it's a catheter over a needle. The catheter is plastic. It will be clear as to why. And it's a one-way needle. So the air's going out, but the air can't come back in. And as you can see, with each breath the guy is taking, the air is moving out, and he is reinflating that lung. The reason it's a plastic catheter is because as the lung begins to expand, the catheter, if it was metal, would puncture his lung and he would bleed to death. So that catheter is soft enough where the expansion of the lung and the visceral pleura won't be punctured. Tell me you got that. That's a needle decompression. Anybody willing for extra credit to undergo a needle decompression? No. Okay. So, again, an open chest wound will produce a sucking chest wound. That is a tension pneumothorax. Now, watch. This is a chest x-ray, and one of the things, if you work in an ICU, you will have to actually read a chest x-ray right? To make sure that if they have central lines in and chest tubes, to make sure that they're in the right place. Couple of things about this, and just real quick. With x-rays are really good at looking at tissue that's very dense. That's why x-rays are really good at looking at bones for fractures and things. Now, any tissue that's very, very, not dense, like air is not dense, it's going to show up as black, right? Because you're not absorbing x-rays. Denser tissue will absorb x-rays. So if you look right here, this dude, somebody didn't like him, and they stabbed him, and this is his whole right side of his lung, and there is no lung in there. There's a little part of his lung right here you can see, but it is completely collapsed. And as the pressure builds up in that pleural cavity, what's going to happen is it's going to force the heart and the left lung, shown right here, it's going to push it over. And you can see, look at his trachea. It's supposed to be like midline. This thing's way pushed over, and look at his heart. His heart's pushed over too. So this dude is in trouble. So what they do is they put a chest tube in to suction. So they will put it to a vacuum, and they will suck out that air. And as they suck out the air, the lung gets reinflated. Couple of things. Number one, he gets what's called a paradoxical diaphragm. This diaphragm is pushed down by the pressure, and this diaphragm is pushed up. Also, very sad, you can see he might be constipated too, because he's got a turd right here. A lot of turds today in class. What? How many people followed that? So the bad thing about a sucking chest wound is that it will suck air into the pleural cavity, and it can actually crush the heart. And the crushing of the heart is called cardiac tamponade. As the pressure builds up, the ventricles cannot expand, so they can't fill, so cardiac output drops. Say yes. Okay. All right. I'm going to do this. If you get this right, come on, get this right. I'm going to give you a hint because I like you guys. Ready? What part of your brain controls breathing? What part of your brain? What is? That's right. You were tricked. I was tricking ya.
No, is that right?
Oh, you did?
I said medulla.
Yes, she did.
Before you circled anything, whatever you circled, the wrong.
Eliana Rodriguez did good.
Oh.
Okay, listen up. The medulla controls breathing along with the pons. The pons really has what's called an aponistic center. Ooh, look at Maddie. She's giving me the finger right now through her shirt. No, did you see the middle finger? You saw it, right? Okay. Do you remember Erica from your class, the general class? She's in my advanced class in Kenosha. She flipped me off Friday night. She had glasses, and she goes like this. This is continuous. Here we go. Write this down. The primary breathing center, the central breathing center, is located in the medulla. Everyone, you will get extra credit when you hand in your respiratory/kidney quiz if you sing medulla oblongata. No worries for the rest of your days. Medulla oblongata. Okay, no one's getting extra credit there. Here we go. Guys, I want this whole thing. I'm going, look at Tamaya. She just hated that. I think she's going to have a stroke. She's crying out of only one eye right now. She already stroked. Okay. I want this whole thing. CO2 is the indirect stimulus for breathing. CO2 is the indirect stimulus for breathing. True or false? As soon as you start exercising, breathing rapidly increases. Like right away, boom. That's false. You got me? So when you start moving, true or false, you need more ATP to make your muscles contract. So you need more oxygen, right? So you will produce more carbon dioxide. What gets rid of the carbon dioxide? Your respiratory system. So if your respiratory system doesn't immediately increase its rate and depth of breathing, what's going to happen to the amount of CO2 in arterial blood? It's going to go up, right? You're producing more CO2, but your breathing hasn't increased to get rid of it. So what's going to happen to the amount of CO2 in arterial blood? It's going to go up. So write this down. CO2 in arterial blood is the indirect stimulus for breathing. I want this whole thing. You need to get this. Ready? Here we go. Watch it. What's in the arterial end of the capillary? Oxygen's going to go from high to low, sit at the end of the electron transport chain. CO2 is a byproduct of metabolism, go from high to low. Say yeah. And arterial blood becomes, where do all the veins of the body dump their venous blood? Into the, where? Into the right atria. That's right. Where's that drawing? It was a good one. Here we go. What the hell is this? All right. So watch. Now, all of that venous blood in blue, because it's high in CO2 and low in oxygen, and it's less filling. Every pulmonary capillary has associated with it an alveoli. Say yeah. But if you're not ventilating more alveoli, are you going to be able to get rid of all that extra CO2 from the fact that you started exercising? So what's going to happen to the amount of CO2 in the blood that's going back to the left side of the heart? Well, look at the arrow. It'll tell you. Right? Tell me you understand that. If you're making more CO2 at the cells, but breathing hasn't increased to get rid of it, what's going to happen to the amount of CO2 in arterial blood? It's going to go up. I want this whole thing. The elevated CO2 in arterial blood, this is arterial blood. What part of your brain controls breathing? And we'll abbreviate it MO or P Diddy. Or just Diddy. You got me? There are chemoreceptors embedded in the cell membrane of the medulla oblongata. Guess what chemoreceptors recept? Chem. Are you writing that down? Now watch. What fluid does your brain and spinal cord bathe in? What cerebral spinal fluid mostly made out of? Say it real loud, you're right. Water. Watch. CO2 from the arterial end of the capillary is going to diffuse into the cerebral spinal fluid. Whoop, it's diffused the wrong way. There you go. You got me? CO2 will then combine with wawa, form carbonic acid. Oh yes. Oh, the equation you love to hate. Coming back. Biting you right in the fatty acid. That's my manic laugh. Carbonic acid breaks down to hydrogen ions and bicarbonate ions. And it is the buildup of hydrogen ions within the cerebral spinal fluid that will stimulate chemoreceptors on the medulla. That's why the buildup of CO2 is an indirect stimulus. What stimulates the medulla to cause you to breathe directly? The buildup of hydrogen ions. So any metabolic pathway that increases the amount of hydrogen ions in the blood, DKA, lactic acid production, say yes, that is going to stimulate breathing. Who's got that? Who found that? So, the primary stimulus for breathing is directly hydrogen ions. And this is the central effect of carbon dioxide. The primary central effect is the result of stimulation of chemoreceptors by hydrogen ions in the medulla. Okay, we ain't done yet. Watch it. There are peripheral chemoreceptors. These are important. Peripheral chemoreceptors. And it makes sense. What's the most important part of your body to maintain blood flow to? Your brain. So the two arteries that supply oxygenated blood to your brain are the carotid arteries. Say yes. So you have these bodies called carotid bodies and aortic bodies. They're chemoreceptors. What do they respond to? No, they respond to chem. You got me? Central chemoreceptors are only stimulated by the buildup of hydrogen ions, and really due to the buildup of CO2 indirectly, but hydrogen ions directly. And I just explained that to you, right? These peripheral chemoreceptors can respond to several things. They can respond to drops in pH, which would mean there are more free-floating hydrogen ions in the blood. You got me? They can also respond to drops in O2 levels, hypoxia. And they can also respond to elevated CO2 levels. That's called, you're going to have to learn these terms, hypercapnia. Say yeah. Guys. So, these peripheral chemoreceptors are typically stimulated in abnormal or pathologic conditions. Normally, we're going to breathe due to elevated CO2 indirectly, and then the buildup of hydrogen ions in the cerebral spinal fluid directly. Yes or no? Okay. So watch. What's the nerve that stimulates the diaphragm to contract? What is it? The phrenic nerve. The phrenic nerve exits the spinal cord between cervical vertebrae number 3 and cervical vertebrae number 5. And you have a right and left division of the phrenic nerve. Who's with me? All right? So I'm going to explain to you now how and why we breathe, and I want this whole thing. Then you can ambulate home because no one's paying attention anyways. I don't blame you. I'm tired too. I got this sick feeling in my stomach. That's when you know you're tired. If I tell you to watch some videos, will you watch some videos for me? So you could have lied and just said, yes, Tim, I'll watch them.
She's gonna watch them.
See, that's the mother and Elsa. Yeah,
Right,
see?
that's the mother.
All right? Hey, yeah, don't pick on her. She's going to watch them, Timmy. She's going to bring some cake, too. Are you ready? I want this whole thing. Through metabolism, CO2 will increase in the blood. Initially, as CO2 increases in the blood, ventilations do not increase, right? At least initially. That's going to cause an increase in the amount of CO2 in arterial blood. We got this. That additional CO2 in arterial blood is going to diffuse from the arterial end of the capillary into the cerebral spinal fluid. Say yes, guys. Arterial end of the capillary into the cerebral spinal fluid. CO2 will combine with water, form carbonic acid. The carbonic acid will dissociate into hydrogen ions and bicarbonate ions and is the direct stimulation of chemoreceptors by hydrogen ions in the medulla that will produce an action potential in the medulla. The medulla then will produce action potentials, electrical impulses, that will travel down the spinal cord. Where does the phrenic nerve exit? Between C3 and C5. Who's with me? Those electrical impulses will travel down both the right and left branches of the phrenic nerve and cause the diaphragm to contract. When the diaphragm contracts, it flattens out. What's connected to the diaphragm? The parietal pleura. So the lungs will elongate by virtue of contraction and flattening out of the diaphragm. So what will happen to the volume of the lungs? And that will lead to a decreased pressure inside the lungs. And now atmospheric pressure will become greater than the pressure inside the lungs, and air will move from high pressure to low. Say yes. In healthy people, the lungs act like a rubber band. Lungs have an elastic recoil. So when you take a breath in healthy people, breathing out is passive, right? It's the elastic recoil of the lungs. In people as they get old, they get lung disease, COPD, they can't get air out. So the elastic recoil of these people's lungs has now left them, and they have to work to get air out. That's the definition of COPD. They can't get air out of their lungs. So what happens to the air inside their lungs? It's trapped and it starts hyperinflating their lungs. Then you get this. You know what you get? What do you get? You get what? You do. All puffy chested like you got something going on. You ain't got nothing going on. Hang on. Where is it? Son of a... You know, I figure out people swear a lot in this class too. What the hell was that? Oh, here we go. That's barrel chest. The lungs, the rib cage itself will actually begin to conform over time and expand to allow that increase in dead space in the lungs. This is my uncle. And for years, he was a smoker. I get it, right? The thing, I knew this guy all my life, and I never recognized the black rectangle around his eyes. Never saw that. This is a dude you can see where he was intubated and he's on his way out. So this guy has emphysema. And emphysema is basically destruction of alveoli and the associated pulmonary capillaries. So this guy has a lot of dead space in his lungs and decreased surface area for gas exchange. So these people breathe like this. Fast, right? And in order to eat, what do you have to do? Do you breathe when you eat? You better not, or you suck an olive down your lung, right? You have to hold your breath. These people can't hold their breath long enough to eat. That's why they're skinny and raily. Tell me you got that. So if you want to lose weight, just smoke a ton of cigarettes and get emphysema. All right, ambulate home. Hey, if I put on Blackboard the videos to watch, would you watch them or no?
Yeah.
Would you really?
Of what?
Of respiratory? Would you just, you don't have to study them, just watch them. Would you?
Yeah.
So that I don't get that, 1,000-yard stare. Huh? And I get it. I don't even, Quit.